MIST is the FDA-approved treatment for men between 30 and 80 years of age. The first procedure under this MIST umbrella is called Rezūm. It involves the placement of a rigid cystoscope entering into the prostatic space, and we use a single disposable gun that has a very small 1 centimeter needle under motorized direction. Once we're in position, we will press a button on that gun that dispenses that needle, and over 9 seconds delivers 0.42 milliliters of steam into the prostate, which is just under 250 calories in 9 seconds. An injection is done every centimeter, so a 4 centimeter prostate will get approximately 8 injections, 4 per side. And this steam will induce atrophy and shrinkage of the prostate. And in fact, we've studied a 30% reduction in prostate volume is delivered through this 5-minute procedure. It is a very quick procedure that can be offered to men with all prostate sizes and shapes. And we do this procedure with over 80% success rate on healthy men, as well as patients who are unhealthy to have anesthesia. So Rezūm is a unique procedure and is one of the few MISTs that can be done in the office, no general anesthesia, no spinal, and you're typically in and out of the clinic in less than an hour. The downside, however, is that you do need some time for that tissue to absorb, and we do need to place a catheter for at least 7 days after the procedure. Rezūm therapy can also be offered to men in chronic urinary retention. However, the catheter will be kept in usually longer, between 3 and 4 weeks. Other side effects from Rezūm treatment, and perhaps the only real big downside, is that because we're using a thermal energy injecting steam into the prostate, there is some burning and discomfort when the tissue has been treated and needs to be sloughed. This usually is absorbed within 4 to 6 weeks after the procedure. In summary, Rezūm therapy is an outpatient, office setting treatment which can be treating patients of all sizes of prostate volume, certainly in anticoagulated or unhealthy patients, men in retention, men with a median lobe. And the real benefit here is that we're able to shrink the prostate, one of the few MISTs that actually deliver a treatment to shrink the prostate, preserves ejaculation and full sexual function, and has very low retreatment rates. So in studies of up to 5 years data, our retreatment rate is under 4%. And if there were to have need for a secondary treatment, the patient can have another redo Rezūm or any other therapy. For more information on BPH therapies and evaluation, speak to your family physician to get consultation to your local urologist.